Chapter 9 is addressing the nervous system, is the first part of the nervous system lectures, addressing the spinal cord and the spinal nerves. The overview of this lecture will discuss divisions of nervous system, including central and peripheral nervous system. We'll describe neurons and neuroglia. We'll look at the nervous system at work. We'll describe spinal cord and nerves, and we'll give an overview on clinical aspects. This slide is summarizing the learning objectives for this lecture. The big question is, what is the main role of the nervous system? And there is no body system that is able to function alone. If we are looking into our systems and into how our body functions, we see that all our systems are interdependent and work together as one unit in order to maintain the health and the well-being of the individual. In all this interdependent type of work, the nervous system serves as the chief coordinating agency for most of the body function. Any type of condition that will change within or outside the body will be detected by the nervous system, and the nervous system will generate a response to continue a certain activity or to correct it. If you want, the nervous system can be compared to a control system that will gather information through what is called sensory receptors. Will have the sensory input that will detect changes both inside and outside the body. Will have a place where the integration of all information happens, and that's the brain and the spinal cord. And those are will respond as switching centers, and will have an effector or producing an effect limb of this process through the motor output, through the nerves that will carry messages out from the centers to different types of effectors in our body. So how we can divide the nervous system? Nervous system can be divided into central and peripheral nervous system. In the central nervous system, we have the brain and the spinal cord, and in the peripheral nervous system, we have the cranial nerves and the spinal nerves. Quick question regarding anatomic divisions. What structure makes up the central nervous system, and which of those will make for the peripheral nervous system? Please review this image and answer the question. When we are looking at the peripheral nervous system, we can divide them into two other divisions. And one will be the somatic nervous system that is under the voluntary control, and the effectors for this division are the skeletal muscles. And we have another component that is called the autonomic nervous system that is involuntary, and the effectors are the smooth muscle, cardiac muscles, and the glands. Question number 1 asks which division of the nervous system exclusively controls skeletal muscles? And we have peripheral nervous system, central nervous system, somatic nervous system, or autonomic nervous system. The answer is somatic nervous system is the nervous system exclusively controlling skeletal muscles. In order to understand how our nervous system functions, we need to understand its structure. And we'll start by describing the neuron structure. So the neuron is considered the unit of the nervous system. Is made out of a cell body that will contain the nucleus and will have extensive rough endoplasmic reticulum in it. In addition to that, the neuron has two types of projections. We'll have the dendrites and the axon. Dendrites are neuron fibers that will conduct impulses towards the cell body. If you see the small arrows, you can see how the dendrites will conduct the impulses, the information toward the cell bodies. And you can see that they are usually highly branched, and they have this aspect. They look like a tree, and a lot of those dendrites function in our body as receptors for the nervous system. And the other projection from the neuron cell body is a long one that is called an axon. And those neuron fibers will conduct impulses away from the cell body. Those impulses can be delivered to another neuron, to a muscle, or to a gland. Every single neuron will have just one axon. And sometimes this axon can be as long as 1 meter. And along the way may give off many branches, like you can see here, this collateral branch. There are a few types of neurons. And again, the neurons are those specialized cells that will transmit messages in a form of electric stimulus. We'll have the sensory neurons. They are also called afferent. Pay attention, starts with an A, afferent. And they conduct impulses to the spinal cord and brain. They will collect information at the level of the inside of the body or outside of the body, and will transmit those to the spinal cord or the brain. We have another type of neurons. They are called motor neurons, or also called efferent. And pay attention, it starts with an E. Efferent, like effector. Efferent neurons, they will carry impulses from the central nervous system to muscles and glands that are the effectors. And they will produce a response to a stimulus that was received before. In addition to that, we have interneurons or associative neurons or central neurons their main function is to relay information from place to place within the central nervous system. They may interconnect between the sensory neurons and the motor neurons also. The myelin sheath. And let's describe this structure. So some axons are covered with a whitish fatty substance, and that substance is called myelin. And the myelin insulates and protects the axon. For the peripheral nervous system, the myelin is actually an entire cell, and it's known as a Schwann cell. This Schwann cell, you can see it in the picture, wraps itself many times around the axon like a jelly roll, and they will produce, those cells will produce this fatty layer that provides protection for the axons. If you really pay attention, you will see that those cells are not making a one layer, but the sheath is incomplete, allowing for small spaces in between the Schwann cells. And those tiny gaps are called nodes. Originally, they were called nodes of Ranvier. And they're important because they allow for speeding nerve impulses conduction. At the level of the central nervous system, the myelin sheath is formed by another type of cell, and it's called oligodendrocyte, or oligo means only a few, has only a few dendrites. So one oligodendrocyte will send extensions to myelinate several axons in its vicinity. The cytoplasm and the nucleus remain with the oligodendrocytes, so the central nervous system neurons do not actually have a neural lemma. Neural lemma being, just like if you remember from chapter 8, the sarcolemma. Lemma is the suffix for cellular membrane. Question number 2. Which fibers conduct impulses away from cell body? Dendrites, axons, cell bodies, or neurolemma? Axons are the fibers that conduct impulses away from cell body. Neuroglial cells. Those are specialized cells um, that make up for up to 90% of the both central nervous system and peripheral nervous system. Um, and if I'm saying that, you're understanding that our neurons are only 10% of the whole amount of the nervous tissue. Neuroglia is a support cell. And the name of glial comes from Greek that means glue. We already described before the Schwann cell that forms the myelin sheath in the peripheral nerve system, and that's one type of neuroglial cells, but we have some others. And again, their main role is to insulate, support, and protect the neurons, which are the main players in the nervous system. We have the astrocytes, and they have the shape of a star, and you can see them in the picture. And they serve more than one function. They nourish and physically support and anchor neurons. And you can see how they connect between the neuron and the capillaries. They will regulate all the neurotransmitters, and they're absorbing them, and they are degrading them. They are taking care of any excess ions, so they will not going to be able to harm the neurons. They form the blood-brain barrier, um, and they act as a stem cell to make new neurons. These new neurons are important in the generation of memory. So astrocytes can also contribute to repair some damaged area. However, their ability is very, very limited. We have oligodendrocytes that they will form the myelin sheath at the level of central nervous system. Again, you can see them in the picture. Microglia, that's a cell that is able to perform phagocytosis to remove and clean pathogens and any kind of waste materials or dead neurons. We have the ependymal cells that are lining the ventricles of the brain, and those are the fluid-filled cavities, and we'll discuss them next lecture. And those cells are forming a barrier between the nervous tissue of the central nervous system and the fluid filling the ventricles, the cerebrospinal fluid. Now, if you will access the link in red, you will have a summary of the information that we covered until now. Question number 3, which of the following is not an example of a neuroglial cell? Neuron, astrocyte, Schwann cell, or all the options are neuroglia. The only example that is not a neuroglial cell is obviously the neuron. In order to understand how the nervous system works, we need to understand how the nerve impulses are generated and they're moving. Every single membrane in our body, any plasma membrane, is polarized, and this is the result of some type of unequal distribution of both positive and negative ions on both sides of the plasma membrane in the intra and extracellular environments. And in a rest state of a cell that is polarized, that resting potential, membrane potential, is minus 70 millivolts. You will see that if you click on the red link, you can see a movie that explains the concept of membrane potential. In order for an impulse to be created, there is a need for an action potential. And the action potential represents a sudden change in the membrane potential. what is the saltatory conduction now, and how that the saltatory conduction helps nerves to increase the speed of transmitting a nervous impulse. So some axons are coated with that fatty material that is called myelin. Um, when a fiber does not have any myelin, the action potential spreads continuously and is kind of slow, just like in the process that I described before. When the myelin is present on an axon, it insulates some areas. So the current cannot spread through those that are insulated. This will appear to slow or stop conduction, but in fact, the myelin sheath is speeding the conduction because the action potential will jump like a spark from node to node. And this conduction is called saltatory because of that. It's actually faster than continuous conduction, and the more fine movement or action or faster action are needed in a certain part of the body, the more myelin sheath that nerve that provides impulses for that area will have. This slide summarizes the concept described before of the synaptic cleft, where the neurotransmitters are released and they will bind to the receptors on the postsynaptic cell. Question number 4. Sodium channels open early in the action potential to cause membrane to A. Depolarize, potential, repolarize, or degradation. We'll describe now the spinal cord and its structure. So, spinal cord has a small and irregularly shaped core of gray matter made out of unmyelinized axons and cell bodies that is surrounded by what is called white matter or myelinated axons. The internal gray matter has an arrangement in what are called columns of gray matter that extend up and down dorsally on each side, and another column is found on the anterior or ventral region on each side, as so. You can see those columns. Those are the ventral columns, are called also horns, and the dorsal horns for the posterior columns. The bridge of gray matter that connects the right and left horns is called the gray commissure. In the center of the gray commissure is a small channel that is called the central canal. You can see it over here, and it contains CSF. That's the liquid that circulates and surrounds the brain and the spinal cord. There is a narrow groove in the posterior side that is called the posterior median sulcus, and another deeper groove in the anterior side or the ventral side that is called anterior median fissure. The spinal nerves. There are 31 spinal nerve roots distributed as 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. They are made out of a dorsal and a ventral root, making up for one nerve that will pass through the spinal canal and will come out of the spinal cord. Those branches will unite to form networks from neighboring units, and they will be called plexuses. For example, the cervical plexus has branches from nerves C1 through C5 that will provide impulses for the head, neck, and top of the shoulder. The brachial plexus will be made out of branches from C5 to C8 and T1 and provide nervous supply to shoulders and upper limb. Lumbar plexus will be made out of branches from L1 through L4 and will provide nervous supply for the anterolateral abdominal wall, external genitalia, and lower extremities. And the sacral one will be made out of branches from L4, L5, along with S1 and S4, and will provide nervous supply for the buttocks, perineum, and lower extremities. You can see in these pictures that those nerves will be distributed in some regions of the skin, and you have the representation both for the anterior and posterior view for the nerves that will innervate different regions of our body. So whenever the patient is experiencing pain in a certain area, we know what nerve is involved and supplies exactly that area. For example, we know that the lower part of the skull and the back of the neck in the posterior view is supplied by branches starting in the C3. Along with that, C3 will provide nervous innervation for the entire region of the neck, the frontal one, and the area of the clavicles, and a little bit on the sternum. C4 will provide innervation for the shoulders, both in the front and the back. Question number 5. What fluid is found in the central canal of the spinal cord? Blood, cerebrospinal fluid, lymph, or saline? The fluid that is found in the central canal of the spinal cord is the cerebrospinal fluid. Question number 6. The phrenic nerve arises from the brachial plexus, lumbosacral plexus, abdominal plexus, or cervical plexus. The answer is the phrenic nerve arises from the cervical plexus. We'll discuss now reflexes and what a reflex arc is. The neural pathways that formed inside the nervous system, they develop in order to coordinate responses. And most of those pathways become very complex and will involve a lot of neurons, and they will have a lot of interactions between different regions of the nervous system. In order for the body to be efficient in its answers to a stimulus, especially if that stimulus is a danger that will immediately put our life in danger, the nervous system developed a reflex arc. So a reflex arc is that complete pathway through the nervous system from a stimulus to a response to be very quick. It can be seen as a basic functional pathway. The most basic example is the one when an area of the body is injured, like touching something sharp. The reflex is to remove that area of your body as soon as possible from the area that was injuring you. In other words, a reflex arc will be made out of a few components. And the first one will be the receptor that will detect the stimulus, most of the time the one that is injuring someone. And it will be the end of a dendrite or some type of specialized receptor. The second component will be a sensory neuron that will be connected to that dendrite. It is the cell that will transmit the impulses toward the central nervous system. The third component will be at the level of the central nervous system that will integrate the information from the sensory neuron and plans a response. Will recognize a dangerous threat to our health and will send out an answer. The answer will be sent out through what is called a motor neuron that will carry the impulses away from the nervous system to an effector, usually a skeletal muscle. And the last component of a reflex arc will be an effector, that skeletal muscle that will receive the nerve impulse from the central nervous system and will create the action that was expected as removing your arm or your body part segment from injury. Again, for a reflex arc, we have the receptor, we have the afferent loop, the sensory neuron that will bring in the information that will be exchanged at the level of the central nervous system that will create the response that will be sent out through the motor neuron to the muscle to remove the arm from the harm's way. So those simple reflexes are rapid, uncomplicated, and a kind of an automatic response, and they will involve usually very few neurons, and they are very, very specific. Um, when you fling out an arm or a leg to catch up your balance, when you're withdrawing from a painful stimulus, when you blink to avoid an object that approaches your eyes. All those are very simple reflex arcs, and they are close at the level of the spinal cord. That's why they are called spinal reflexes. The stretch reflex. Um, this is a reflex when a muscle is stretched and responds by contracting to that. And that's another example of a spinal reflex. The knee-jerk reflex, when we are testing reflexes in the doctors is testing the knee-jerk reflex as a part of a head-to-toe examination, is also a typical example of a simple reflex. Question 7. What is the correct order of impulse conduction through a reflex arc? You have option A, B, C, and D. The correct order of impulse conduction through a reflex arc is receptor, sensory neuron, interneuron, motor neuron, and effector. Please observe that here interneuron is at the level of the central nervous system. We'll compare and contrast a little bit the somatic and the autonomic nervous system while we are describing the autonomic nervous system. The autonomic nervous system is the one that will regulate the action of glands, smooth muscles, of hollow organs and vessels, and the heart muscles. And all those actions are carried out in an automatic type of way. Whenever a change occurs that calls for a regulatory adjustment, that is made without even us being conscious. And the autonomic nervous system has two components. It's made out of sympathetic and parasympathetic divisions. Most of the visceral organs will receive both sympathetic and parasympathetic fibers. They are kind of counterbalancing each other. With sympathetic system working as an accelerator and the parasympathetic as a cool-off type of system. If we are comparing and contrast with the somatic nervous system, you see that acetylcholine is the neurotransmitter for the somatic nervous system, while in the autonomic nervous system, we have two neurons that will be interconnected instead of just one in the somatic one. And acetylcholine will show up at the level of the first one. However, the secondary one will be epinephrine or norepinephrine. So again, we were talking about the autonomic nervous system, sympathetic and parasympathetic. We have in those will have a preganglionic neuron that will connect the spinal cord to the ganglion and the postganglionic neuron that connects the ganglion to the effector. We'll compare and contrast those two with by clicking on the red links. You can see short movies summarizing both sympathetic and parasympathetic systems. So the sympathetic nervous system is the fight or flight one, will respond to unusual stimulus and takes over to increase activities. In other words, is responsible for the E division, exercise, excitement, emergency, embarrassment. While the parasympathetic is the housekeeping activity that conserves energy and maintains daily activities that are involved in normal body function as the D division, digestion, defecation, diuresis. Whenever the E factor is involved, the sympathetic system, there will be an increase in the rate and force of the heart contraction, will be an increase in blood pressure, partially due to a more effective heartbeat, and partially because of the constriction of small vessels, will be dilation of bronchial tubes to allow for more oxygen to enter and more carbon dioxide to leave. And by stimulating the central portion of the adrenal gland, we'll have even a higher stimulus of norepinephrine, allowing the body to be even better in that fight or flight type of reaction. Question number 8. Which of the following is not an action of the sympathetic nervous system? Increasing blood pressure, stimulation of skeletal muscle, stimulation of the adrenal gland, or dilation of pupils. Stimulation of skeletal muscle is not an action of sympathetic nervous system. We'll discuss for a little bit some clinical aspects related to the spinal cord and the spinal nerves. There are a few types of medical procedures that involve the fluid that circulates in and around the brain and the spinal cord, and we call that fluid the cerebrospinal fluid. The membranes that surround those tissues are called the meninges. One of those procedures is called the lumbar puncture or spinal tap. And during the spinal tap, we can remove the CSF to test for signs of infection, inflammation, and ideally the location for the spinal tap is somewhere between the third and fourth lumbar vertebra, because in this region, the there are the spinal nerves or the cauda equina are presented instead of having a spinal cord per se. On the other hand, what we can do at the level of the spinal cord, we can administer drugs. Pain medication can be delivered into what is called the epidural space, um, or we can do what is called a spinal anesthesia. Um, just to summarize really quick, the spinal cord is covered by three membranes. They are called meninges. From outside inside, we have the dura mater, the tough one, the thick membrane, the arachnoid or the vascular layer, and the pia mater or the thin one. You can see here how injecting um, different different types of substances or drugs will go into different layers where the um, lumbar puncture is done. It's here, while the epidural space is in front of the dura membrane. Disorders affecting the spinal cord will include autoimmune, degenerative, and infection conditions, as well as tumors and also injuries. Um, so diseases as multiple sclerosis, that's an autoimmune condition that as a result of antibodies formed by the patient body that attack the own structures, um, the the patient's body will lose the myelin sheath inside the CNS, the central nervous system axons. And as a result of that, what happens is that the neurons will die. Is probably MS, multiple sclerosis is the most chronic CNS disease seen in the young adults in the United States. And um, as a fact, affects women twice as often as men, um, and it's more common in temperate climates and in people of Northern European ancestry. So apparently, genetics and environment have a big contribution in development of multiple sclerosis. There were some researchers that were um, suggesting some type of prior viral or bacterial infection to set off the disease. Others were trying to advocate that there is a vitamin D deficiency, while the individuals in those type of climates have less sun exposure, so they have less vitamin D. The multiple sclerosis will progress at different rates in different patients, and they can even go into episodes of remission. Amyotrophic lateral sclerosis, or Lou Gehrig disease, is also a degenerative disorder where the motor neurons are destroyed. And as a result of this progressive destruction, um, as a result, we have muscle atrophy and loss of motor control that ultimately the affected patient will not be able to swallow or talk or even breathe. Poliomyelitis is a viral disease with a virus that is the poliovirus. Myelo means spinal cord, and was seen as an epidemic in the 20th century um, until the point that the polio vaccination was instituted. And polio is actually um, an abdominal bug, can be spread by ingestion of contaminated water. It's an infection of the gastrointestinal tract that is causing, in a small number of cases, a toxin and a paralysis of the limbs with eventual respiratory muscle involvement. Um, Nowadays, it's almost not seen, not because polio doesn't exist anymore and was what is called eradicated. It still exists over there. However, because almost 100% of the children are vaccinated nowadays, they do have this viral disease as a very mild gastrointestinal bug. Tumors can develop at the level of the spinal cord, and they arise in the support tissue in or around the cord, and they are frequently tumors of the meninges or the neuroglial cells. The main symptoms result from spinal cord compression, and they result They result in pain or numbness or weakness or loss of function. We can diagnose them by performing MRIs, um, mainly by using imaging techniques, and the treatment is surgery and radiation. Spinal cord injury can be classified by the number of limbs that will suffer as a result of the spinal cord injury. They may result from any kind of wounds or fractures or dislocation of the vertebra, from herniation of the intervertebral discs, or from tumors. They are classified as monoplegia, paralysis of one limb, diplegia, paralysis of both upper or both lower limbs, paraplegia, paralysis of both lower limbs, hemiplegia, paralysis of one side, or tetraplegia, or quadriplegia, that is paralysis of all four limbs. Disorders of the spinal nerves now, neuropathy can be defined as any disease of a nerve. Any type of condition that will involve a nerve can be called a neuropathy. Neuritis, on the other hand, is a general term for inflammation of a nerve. We can have mononeuropathy as affecting a single nerve that is very specific, can result from trauma or tumors, can be benign tumors, or as a connective tissue tumor that will put pressure on a nerve, or they can be a result from a nerve compression, like in carpal tunnel syndrome. Carpal tunnel will produce compression of the median nerve by the carpal bones of the wrist. As a result of that, there will be pain and numbness in the hand. Usually is the result of incorrect positioning of the arms while working, especially for those that are typing, playing video games, or playing an instrument. It's been seen a lot in surgeons, especially those that are involved in a lot of laparoscopic procedures, because of the way that the instruments needs to be held and manipulated. Mortal neuroma is another type of mononeuropathy, in which the tarsal and metatarsal of the foot will compress the plantar nerve. And it's a very common seen in women. And it's seen in those that are wearing pointy or high-heel shoes, those type of shoes will contribute to a chronic compression of the nerve. Sciatica will be pain and numbness and tingling along the path of the sciatic nerve, and results from the compression of the sciatic nerve or one of the contributing spinal nerves from a herniated disc. Sometimes can be a bone spur or the weight of the pregnant uterus. Mononeuropathy was one nerve. Now polyneuropathy or polyneuritis will impact more than one nerve, and the symptoms will be weakness and numbness, paralysis, cramps, or spasms. Tumors can affect single nerves or can affect more than one. There are usually genetic mutations that will cause abnormal proliferation of Schwann cells, and they are called schwannomas, or fibroblasts, and they are called neurofibromas in the nerve coverings. And as a result, they produce nerve compression and all the symptoms related to that. Toxins also can cause polyneuropathy. Will have intoxication with alcohol or lead. Some medications also, especially those that treat cancer or HIV. Probably the most common toxin that can produce neuropathy is the increased levels of blood glucose for a long term. And the most typical polyneuropathy is the one seen in diabetes patients. As a result of it, they will lose sensation, including pain sensation in their feet mainly, and that can lead to injuries and wounds that may take a very long time to heal. Infections, particularly HIV and hepatitis and Lyme disease, can cause polyneuropathy. Herpes zoster can cause shingles, is an infectious neuropathy characterized by a lot of blisters along the course of certain nerves, most commonly the thoracic nerves and their branches. In most cases, shingles is a reactivation of prior chickenpox virus infections. Initial symptoms will include fever and pain, followed by, in about 2 to 4 weeks, by the show up of vesicles that are fluid-filled skin lesions. Keep in mind that those lesions are highly contagious because they are eliminating a high number of viruses in that liquid. And autoimmune disorders that are causing polyneuropathies are the example that I can give is the Guillain-Barré syndrome, that is an acute form involving spinal nerves and nerve roots. So if we compare and contrast Guillain-Barré with multiple sclerosis, MS will target the myelin coating, while Guillain-Barré will impact the myelin coating of the peripheral nervous system. In this condition, there is a progressive muscle weakness and paralysis that begins in the limbs and descends to the respiratory muscles. Um, what's fortunate about this condition is that the peripheral nervous system neurons can be repaired compared with the central nervous system. And the myelin sheath from the Schwann cells can be recovered, can remyelinate themselves and repair. So there is a big chance of recovery from Guillain-Barré syndrome. And usually Guillain-Barré will follow, just like MS is, a bacterial or viral infection. Question number 9. Miss L has been experiencing muscle weakness. Her physician informs her that she has abnormal antibodies attacking the myelin sheath around neurons in her central nervous system. The most likely diagnosis is poliomyelitis, multiple sclerosis, amyotrophic lateral sclerosis, or peripheral neuropathy. The answer is multiple sclerosis. Antibodies attacking the myelin sheath around neurons in the central nervous system is characteristic for multiple sclerosis. Please take time and review video 1 and video 2 that they are reviewing the concepts presented in this lecture.